So the AQUA Registry is an effort by the AUA, the American Urologic Association, to compile a large database where, for different types of urologic diseases, individual urologists or urology practices will be able to submit their data on individual patients and ultimately compare themselves, how they do, how their patients do, what kind of outcomes they have, compared to other physician groups and other urologists throughout the country. It'll be a way of benchmarking oneself and hopefully lead to improvements in the quality of care for patients. This is really an innovative program and an innovative database, one of the few in the world that's similar, one of the few in the world like this. The way that it works is actually they capture data from our health record and then it's put in this database and used to compare to others. So they wanted to start just from a beginning platform to really start with one common urologic disease. And prostate cancer is very common. It's something that gets a lot of attention in the media, and it's something that there are a lot of questions about different types of outcomes, different treatments, and how we should be dealing with those patients. So I think there are other oncologic indications, things like bladder cancer, kidney cancer, the management of kidney stones, the management of urinary incontinence. There are a number of other ways that this can go as we sort of get a better handle on how things are going to flow. So there are already approximately 200 to 300 other groups that are participating, and that makes up almost 3,000 urologists, which if you consider that there are probably 8,000 or 9,000 urologists in the entire United States, we're coming close to almost 1 out of every 3 urologists in the country participating. The bigger the registry, the more data one will have, the more one will be able to benchmark themselves against others, perhaps others in similar geographic situations, others who have similar kinds of patients. And beyond just serving as a way that we can improve the quality of care for the individual patient and allow the individual physician and practice to see how they're doing, this will also allow on a more macro level the AUA to address certain things, to look at certain trends, to formulate questions based on what everybody's doing out in the real world. Well, I think the individual urologists and groups will be able to compare themselves to others, see how they utilize different treatment paradigms. Are they doing it like the majority of other people are doing it? And really look at their outcomes. For instance, what kind of incontinence rates do their patients have after surgery for prostate cancer? And if it's significantly different from their peers, then they would then go back and hopefully look at ways they can improve, which help ultimately the patient, which is what our main goal is. So ultimately, one of the goals of this is that the AUA, the quality committee, and perhaps others in the future will be able to look into this database and answer various research questions. They'll be able to look at different trends, different types of outcomes, and formulate questions that hopefully, at the end of the day, will be able to improve the state of urologic care.